Welcome to Tuesday's coverage of COVID-19. Efforts to rein in the latest outbreak that began in mid-August appear to be bearing fruit, but uncertainty over the future course of the pandemic in light of the Chuseok holiday has authorities on high alert. We start the program now with the latest numbers here in Korea and elsewhere around the globe with our Kwon So-ah and related news with our Kim Han-eul. So I believe we are seeing a tangible drop in cases here in Korea today.
Yes, Sunny, the number of daily infections has declined to where authorities want them to be before the Chuseok holiday kicks off, which means under 50. So this Tuesday, the country reported 38 new cases, and that's the lowest in 49 days, and almost at the level we have been before the massive outbreak in the metropolitan region, which was around mid-August.
Right. So, and I have to admit, I'm feeling a sense of ambivalence here. It's comforting to see that our daily caseload is dropping, and at the same time, I'm worried that this might lead to less public caution over safety efforts.
Right, Sunny, I agree with you on that. And I'm feeling the downward trend could give the wrong impression to people that the worst is over, especially if we take a look at our graph now. We are seeing quite a drop since Sunday here. And also for 4 consecutive days, the numbers have been in the double digits. And however, authorities have been stressing on a daily basis, extra caution is needed during the Chuseok holiday. And health officials are especially on high alert as many people are expected to start their journeys today. And if we go over to our map, as it is with major holidays, many people here in the metropolitan region do move to other places, to their hometowns, for example, in the south. So that is why authorities are worried that the infections that are concentrated in the metropolitan area could spread to other parts of the country. Now, this Tuesday, we do see double digits in the capital Seoul, 11 here, followed by 10 in Gyeonggi-do province, and some single digits in other parts of the nation. And with that, the total amount of infections in the country stands at almost 23,700. The death toll stands at 407, and we have 141 people less in quarantine and almost 180 new recoveries. And meanwhile, out of the 38 cases, we are seeing that 23 are domestic infections and 15 are cases from abroad. And with that, let's take a look at the global figures. We have more than 33.5 million cases in total and over 1 million fatalities. Meanwhile, some 24.8 million people have made a full recovery of COVID-19. And let's take a look at the hotspots around the world. We have the US at almost 7.4 million, followed by India at 6.1 million and Brazil at 4.7 million. These countries are still adding some tens of thousands of new cases on a daily basis, although there has been seen a decline in India, which recently even had over 90,000 cases, but it looks like now they are at around between 60,000 and 70,000. Meanwhile, Argentina is also seeing over 10,000 cases in a day. Let's move over to other places. There are quite some countries with resurgences in Europe, including France, but here we are also seeing a decline in daily cases, although still a concern in France and UK, as well as many other countries which are seeing thousands of cases still spreading in these places. And those are the updates I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so thank you for that. Now, as we've been reporting, special disease prevention measures are in place to allow for a safe Chuseok holiday this year. I have our Kim Han-eul in the studio with more details on that. Welcome, Han-eul.
Good afternoon.
Now, Han-eul, for the sake of those who may not be familiar with the upcoming extended Chuseok holiday, could you perhaps clarify the actual length of rest this year?
Sure. Chuseok, which is the Korean equivalent of Thanksgiving, is one of the 2 major traditional holidays here in Korea set by the lunar calendar. So let's take a look at the calendar here. The 3-day public holiday starts tomorrow, and the actual day of Chuseok falls on October 1st this year. October 1st is also Armed Forces Day, although this year celebrations took place last Friday on September 25th to avoid an overlap with Chuseok. As you can see, the 3-day Chuseok holiday is immediately followed by the weekend, which essentially makes this year's Chuseok a 5-day holiday. Saturday, October the 3rd is National Foundation Day. And if you take a look at the following week, Hangul Day, which falls on Friday the 9th, is also a public holiday. So there is a 3-day weekend there as well. So this is why the government's special disease prevention period will last until Sunday the 11th instead of covering only the Chuseok holidays.
I see. So, Hanul, authorities believe abiding by strict guidelines during this 2-week period is important in curbing the further spread of COVID-19.
That's right. After seeing a spike in the number of cases following these long holiday weekends back in May and September, the stakes are really high at this point for the next 2 weeks. So health officials say that this could very well determine the future course of the outbreak in the coming months. Take a listen.
We're all aware how the holiday weekends in May and August and the mass movement of people during those periods led to the spread of COVID-19 epidemic and the related consequences. I stress again that the future outcome of the COVID-19 outbreak this coming fall and winter will be determined by how well we exercise preventive measures during the Chuseok and Hangul holidays.
Yesterday, during the government briefing, KDCA Commissioner Chung Eun-kyung pointed out 2 major risk factors for the upcoming holiday period, which are family gatherings and holiday travel. The commissioner warned of the danger of large family gatherings, referring to the case in May following Parents' Day, where an entire family contracted the virus after dining together. She also urged the public to refrain from traveling and taking precautions, even when outdoors, as the virus can still spread when people are talking and eating in close proximity.
Now, although the government has urged for people to stay at home, if travel is a must, how can you protect yourself and your loved ones during this holiday, Hanul?
Well, if you have to travel, remember, be vigilant about safety. And keep in mind that if you are planning to drive long distances during travel, highway tolls will be collected and only takeout orders will be available for the rest stops. So those of you traveling to and from the Seoul metropolitan area, public transportation will be extended until 2 a.m. on Thursday and Friday. This is to meet the high demand for late-night public transit during the holiday period. Express and intercity buses departing from Seoul will also be running on extended timetables from Tuesday to Sunday. However, buses that stop at public cemeteries will not be operating more frequently, as the government has recommended people not to visit their ancestral tombs and shrines during Chuseok.
Right, national cemeteries will be closed during that particular period. So which venues will be open and which ones will be shuttered during the Chuseok holiday?
So let's first talk about the venues that will be closed. The 11 so-called high-risk facilities that includes clubs, bars, and buffet restaurants in the densely populated Seoul area are closed for the special 2-week period. Outside the capital region, 5 types of venues that have been deemed unsafe, such as nightlife establishments, are also required to shut down. However, if you are itching to get out, restaurants, cafes, and cinemas will be open, but under stricter protocols. Restaurants, coffee shops, and bakeries that have 20 seats or more must maintain a distance of at least 1 meter between tables. Theaters and cinemas in the Greater Seoul area are required to leave middle seats empty, and amusement parks will be required to operate at 50% capacity or less. Well, on a more positive note, some of the lockdown measures have been lifted in the capital. For Seoul residents, state-run cultural facilities such as Seoul Museum of Art and Seoul Metropolitan Library will be open at limited capacities for 2 weeks during the special holiday period. However, this only applies to the Seoul metropolitan region. Many provincial governments have canceled their cultural events and festivals ahead of Chuseok.
Hanul, one final question before you go. I hear that testing centers will be operating during the Chuseok holiday, though.
That's right. The COVID-19 screening centers will be operating as usual, and also temporary testing facilities will be set up to deal with any type of contingencies. Health officials encouraged people to get tested if they have any suspicious symptoms during the holidays. However, each center may have different operating hours, so you should check their official websites or call the government hotline before visiting one of these locations.
All right, Hannah, thank you for that coverage. Have a safe holiday and I'll see you next week.
See you then.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular government briefing on COVID-19 for this Tuesday. While daily caseloads over the past few days have been the double digits, authorities are still concerned. We have the briefing now. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 response here in South Korea for September 29th, Tuesday. As of today midnight, we have 23 new local infections, and the total caseload now stands at 23,699. And 178 more people have been discharged, and 1,822 people are in quarantine. And there are 115 patients with critical or severe conditions, and we had one additional fatality. I extend my deepest condolences to the deceased and the members of the bereaved family. As of today, at noon, we have some updates on our domestic infections, and here are our updates. And please note that the numbers could be subject to change. And first, starting from the Seoul city, in relation to Dana Hospital in Dobong-gu District, we have 2 cases being confirmed earlier in September, and currently we are carrying out extensive testings for all of the staff members as well as patients there as well. And next, moving on to Gyeonggi-do province in Anyang city, in relation to a music studio, we also have 2 additional cases, and a total of 13 people have been confirmed to date. In Seongnam city, in relation to a defense industry corporation, we have the first case on the 24th of September, and we have 9 more cases, and a total of 10 people have been confirmed to date. And next, in Gyeongsangbuk-do province, Pohang city, in relation to an elderly gathering, we have 12 people being confirmed so far. And in relation to Donga University in Pumin campus in Busan city, we also have 2 additional cases being confirmed, and a total of 16 people have been confirmed to date. And next, as for the imported cases, we had 15 imported cases, and as for the countries of origin, we had 3 from the Philippines and 2 from Qatar and Poland, respectively. And the Safety Ministry has currently operating the Safety E-report, and we have some examples that have been reported on this application. And first, we have an example of a report on the senior citizens facility, and people did not wear face masks, and they did not keep social distancing while enjoying dining together. And also, secondly, in a nursing hospital, despite the ban on the visits, they did not have in place such a ban, and people did not wear face masks, and there were not a sufficient amount of a level of screening of the body temperatures as well. And these have been some of the cases that have been reported so far. And next, as for the supply of the remdesivir, as of today, we have 459 patients across 60 hospitals being administered with the drug so far here in South Korea. As for live quarantine measures, we believe that this Chuseok holiday is very vital. And starting from this today, even people would be enjoying the extended holiday. And we ask you to refrain from going outside and stay home safe and sound for the safety of yourself and your loved ones. And in the past, we have had had some long extended holidays, and this was also this also ignited and made a rebound in the number of confirmed cases. So during Chuseok holiday, we ask you to stay home as much as possible and to refrain from making non-essential visits or travel. And especially as for the senior citizens who are at higher risk of developing severe illnesses when affected by COVID-19, we currently encourage the families to communicate with them via video chats instead of visiting them in person. And if you have to go on travel or if you have to be on the roads, please abide by the quarantine measures at all times. But first, it is also very important to remember these protocols. First, when you are on the road, please use your private automobiles. And as for public transportation, please utilize online reservations as well. And please refrain from visiting the public venues like the rest stations. And also pack your snacks in advance before you hit the road. And when you are visiting your hometowns to visit your relatives, please wear your face mask at all times and wash your hands on a regular basis. And when you are dining together, please refrain from engaging in dialogue and please wear face masks before and after eating at the meal, and also minimize the number of attendees at the ancestral rituals. And also, instead of hugging each other, please bow to each other as a means of greeting. Moreover, during the Chuseok holiday, we want to note that the screening clinics will be operating as usual, and it will also enable extensive testing of the public if you feel the need. And we also have the emergency medical services portal website and also the Ministry of Healthcare website, and we also have the emergency hospitals that will be open during the Chuseok holiday. So please take a look at these websites before visiting these health clinics in person. And during the Chuseok holidays, if you are going through some mental illnesses, please consult with our hotline via 1339. We are providing the psychological consultations as well. And we have a few words before we close our briefing today. The COVID-19 outbreak is currently maintaining in the two-digit number in Korea for the past 5 days. Aside from Seoul, all of the local authorities have seen a one-digit number in the on-day increase. Of course, the daily statistics has not a very significance, and we believe that this is a hasty measure to be too focused on these numbers. However, we believe that this downward trend were the results and the outcome of the weeks-long efforts of the public in practicing social distancing measures. And the local authorities and the quarantine authorities would also like to note that we are trying to trace down the patients who might be silent spreaders throughout the communities. Currently, we are containing the virus to a certain extent, and we believe that this will have great significance going forward in 3 aspects. First, the downward trend that we are witnessing right now will also enable us to be well responsive in the future. As we have a smaller number of daily cases, we will have more capacity to deal with the epidemiological investigations. And we believe that these research and investigation and more detailed methods will be available, and this will enable us to contain the virus even further, and we believe that this will be very helpful for our society. And second, we can be better prepared for the future. If we go through the Chuseok holiday and the special antivirus period, if we contain the virus by practicing social distancing measures, and if we contain a massive outbreak, we believe that onwards we will have a new horizon of the social distancing measures which will be put in place. And we believe that we can minimize a wide outbreak in the winter as well, and we will have a great sense of confidence us and a great sense of unity and solidarity as well. And we believe that the wearing of wearing a face mask and practicing of social distancing measures will become part of our habit and part of our new culture. And this will give us an opportunity for us to return back to our normal daily lives and normal economic routines. And we believe, third, this would also help us in transforming and reaching a very crucial moment in combating the virus. We believe that globally we will have a vaccine which will be developed very soon, probably next year. And we believe that these vaccines will be tried starting from early next year. And if we are able to contain the virus and control the extent of the virus, we believe that we can prepare ourselves to carry out the vaccinations of the public for COVID-19. Just mentioned during the briefing earlier, we have mentioned to you some protocols that you need to keep in mind during the holiday. The quarantine authorities have great confidence and great trust in the energy and the potential that our public has. We believe that you yourselves are a very great credible partners in our fight against COVID-19. If we explain the COVID-19 in terms of biological terms, we believe that we ourselves are also adapting to these new changes as well. If we look at some international media, we came to realize that it is very difficult to find very similar countries like our own in other parts of the world. Starting from tomorrow, we will be enjoying an extended holiday thanks to Chuseok. And if you continue to comply with the quarantine measures just as you did now, we believe that we can keep our society safe even after enjoying this week-long holiday. So please enjoy your holiday and keep yourself safe. And please help us in moving towards a new transition. Thank you very much.
Right, there was Kwon Junuk, Deputy Director General of the Central Disease Control Headquarters with Tuesday's afternoon briefing. So what was the gist of his address today?
Well, as we could predict, perhaps he had some important messages ahead of the Chuseok holiday, which begins tomorrow. So he told the nation's people to take a rest at home if possible and try not to travel. But if you really have to travel, try to travel in your own cars, he said, and also try to turn to alternatives to meeting elderly people in person. And he also said to minimize time at rest areas and have your snacks with you beforehand if you travel by car. But really, the gist is that try to stay at home and not travel around. And also, if anyone feels symptoms of the coronavirus, testing screen centers will be operating during the Chuseok holiday. So if you do feel symptoms, you can check information on the operating hours online. And also, for minimizing movement during the Chuseok holiday and abiding by social distancing, the official mentioned we can open a new scheme and after the holiday and also get safe through the winter season.
Right, so all right, so happy Chuseok. I'll see you on Monday.
Thank you. Happy Chuseok.
Right. Also, on the local front, applications for intellectual property rights, such as patents, are on the rise as local firms roll out innovative ways to combat COVID-19, providing health authorities here with powerful tools to keep the outbreak in check. We have more in this following report.
Back in August, Korea was left stunned by a large cluster infection that broke out at a franchise coffee shop, in spite of distancing measures in place. Since then, wearing a face mask except when drinking has become a common practice at cafes nationwide. This branch in particular has even installed air purifiers to keep its patrons safe.
커피를 즐기러 카페로 왔을 때 공기청정기가 잘 배치가 되어 있으면 안심하고 잘 이용할 수 있는 것 같아요.
Though it may look like an ordinary air purifier at first glance, this particular device uses UV rays to kill harmful pathogens.
UV LED를 이용해 인체에 해로운 화학 성분 사용하지 않고 오직 빛으로만 살균과 탈취가 가능한 신개념 청정 기술입니다. 고려대와 살균 실험을 통해 신종 코로나 바이러스가 99.9% 살균되는 결과를 확인하였습니다.
This local firm's so-called Violet's technology has earned many patents both at home and abroad since 2005 and has come into the spotlight following the COVID-19 pandemic. COVID-19 has opened up new opportunities for Korean biotech firms and other businesses, which are looking to get a leg up on their competition by filing new patents and developing new technologies. Korea's unique walk-in testing booths were patented in August, and other similar patents are sure to follow.
2월 1일 모두 97건이 특허 출원되었고 이는 사스나 메르스와 같은 다른 호흡기 증상 바이러스 유행 때와 비교할 때 단기간에 매우 높은 증가세를 보이고 있는 것입니다.
New patents are also being filed for face masks, the number of which has tripled so far this year until the month of August, compared to all of last year. New types of masks include those equipped with small micro-air purifiers to help users breathe more easily. There are also masks that provide better protection against pesticides, masks for household pets, and even ones that open and close to allow wearers to eat and drink. Other innovative ideas are springing up left and right, from big businesses and creative individuals alike.
첨단 IT 기술이라든지 IoT 기술과 이렇게 융합이 된 스마트 마스크 이런 쪽도 출원이 이제 계속 늘어나고 있는 추세입니다. 지금 이렇게 출원되는 건들이 이제 마스크의 그 향후 진화 속도를 상당히 빨라지게 할 것으로 저희는 보고 있고요.
The commercialization of these new ideas raises the need to better protect their related intellectual property rights. So what can be done to ensure that this is the case?
특허는 기본적으로 내가 갖고 있는 아이디어나 기술을 법적인 표현과 법이 정하는 규칙 내에서 권리를 내가 얼만큼 잘 확보하느냐에 대한 문제이기 때문에 명세서의 청구 범위를 잘 작성해야 되거든요. BM 특허를 얼마만큼 전략적으로 잘 만들고 내 사업을 보호하느냐가 상당히 중요한 이슈가 될 것 같습니다.
Elsewhere around the world, COVID-19 is back with a vengeance in the Czech Republic, where new cases have doubled this month as infections surge at the second fastest pace in Europe. I have Diana Petriashvili, a freelance journalist in Prague, live on the line with more. Welcome, Diana.
Hello, Sani. Thanks for having me.
Diana, I believe it was on the last day of June that people there celebrated the end of the country's COVID-19 lockdown. Now, back then, the country of about 10 million had seen 12,000 confirmed cases and 349 fatalities. In recent days, however, the situation has made a drastic U-turn, I hear. Diana, please tell us more.
Yes, you are right, Sunny. The situation had changed dramatically after the second part of August, and Czech Republic reached and passed the index of 3,000 daily cases of infection. Health officials warned that in a worst scenario, we might face up to 6,000 daily infections per day. Which is, yes, the situation seems to be quite scary. Yes, you're right.
I see. Currently, I understand you have more than 65,000 confirmed cases in total then?
That's true.
Diana, the Czech Republic initially had been hailed for its quick response to contain COVID-19 with mask mandates and lockdown measures. What appears to be the reason behind the resurgence there?
Well, here in Czech Republic, we sometimes say that we are now paying for all the fun that we had in summer. Because in summer, Czech Republic enjoyed maybe the easiest regulations concerning coronavirus in Europe. Everything was open, pubs, restaurants, nightclubs, and people were careless enough for not keeping social distancing. No face masks were required, which is also viewed as one of the possible reasons behind the dramatic rise in COVID figures.
I see, Diana. How are authorities now seeking to tackle this new outbreak then?
Well, we are expecting probably a state of emergency will be announced again tomorrow. At least some important statements are expected tomorrow. But also some of the restrictions are already in power, like, for example, college students went studying online, and restaurants and bars now close earlier than usually, and masks are required again.
I see. Yes, I understand that the entertainment facilities are now supposed to close about 10 p.m. then.
That's right, yes. Everything will be closed at 10 p.m.
I see. Dinah, what then are some of the toughest challenges faced by members of the public amid the second outbreak in the Czech Republic?
Well, it's of course it's economic issues, because the Czech economy lost billions of euros, and dozens of thousands of people lost their jobs and lost their income. But also it's very tough because Czech economy, it will be very difficult for the Czech economy to bear another lockdown, and it's also, everything is related to the shortage of doctors, because if, let's say, schools go on quarantine again, some of the medical workers will have to stay at home with their little children. So everything is very, very difficult.
I see. Well, that is the case for many countries across the globe. All right, Diana, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you very much, Sunny.
5월 초 연휴 그리고 8월의 학예 연휴 기간을 거치면서 코로나19가 전국적으로 확산되거나 억제됐던 환자 수가 다시 증가하는 경향을 보여왔습니다. 사람 간 만남과 이동이 줄어들면 바이러스의 확산은 멈춥니다.
The 5-day Chuseok holiday is poised to begin tomorrow, and as part of efforts to keep daily caseloads within manageable capacity, authorities have imposed special safety measures until the 11th of October, as past trends show a tangible surge in cases following long weekend holidays. Now, for more on this, I have our Dr. David Kwak from Suncheon University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
And I also have Professor Chung Seon-jae from Yonsei University. Pleasure to have you back, Professor Chung.
Thank you for having me again.
Professor Chung, starting from this past weekend, that will be Saturday to be exact, daily cases have been hovering in the double digits, and today Korea recorded 38 new cases. From those, of course, 23 are local and 15 were from abroad. What are your thoughts on this latest trend?
Well, although it's a little bit early to judge right now for the decreasing trend, but I think it's significant. Actually, from the 441 confirmed cases on the August 26th, this decreasing trend has been remained about 1 month. So, and I think looking at the overall incidence graph too, we had the first peak at the March 1st, which had like 1,062 confirmed cases, including Daegu area, which was the highest and the steepest peak. And another peak, I think, is from the end of the summer vacation, which was the August 22nd to August 26th. And the kurtosis continued to reach about 400 confirmed cases, mainly in the metropolitan area. And now we have the decreasing trend. But we cannot be sure, and we cannot be so confident that now it is stabilized. I think we have to be really alert, because from our previous lessons, we have learned after these vacations or after the holidays, also there is a high chance of another peak occur.
You're right, I would have to agree, because back, I think it was on August 11th, we had 34 cases before seeing 103 cases 3 days later. Dr. Kwak, despite the relatively less worrying daily numbers of infections, those with regard to untraceable cases continue to be a source of much concern. Now, in fact, such cases rose to 30% before falling to the 20% range recently. Please tell us more about untraceable cases.
Right, so we have seen the portion of the untraceable numbers to go up to about 30%, and it's slightly decreasing. But I would say the number itself, the number of 20s and 30s and the percentage is not really significant at this time of the year, because the cluster infections, the traceable numbers, also are actually coming from unrooted incidents. Meaning, if we compare ourselves to a couple of months back, we were actually tracing a large cluster of infections that were traceable to, let's say, a certain number of sources. Now we're actually just having cluster infections spring up here and there, actually from unrooted sources. So if we measure those up, I would say about 99 to 100% of the cases that are currently happening is actually untraceable. And also, furthermore, if we count the number of people who were to have been expected to have the virus. So I was going to mention that it's less than being 80% of the people who are actually being confirmed with the case were actually expected to have them. Those are actually also insignificant at this state, because all the numbers, all the confirmed cases that are happening daily are actually from unrooted sources. So at this state, if we the number that is quite positive in the sense that it has been brought down to 30s and 40s, it's still giving me a little bit of a worry, because we do not have a clear idea why it might have gone down so much. I would rather say that we should still stay quite alert, because it can go back up to hundreds or possibly 110s in no time. Because we did not see a specific reason why it went down, we would have no other reason why not it would go back up. So at this stage, we should still stay very much alert.
I see, very vigilant then. Professor Chung, I believe Korea conducts maybe 20,000 tests on a daily basis.
Yes, this is maximum.
I see. Do you believe that we should perhaps boost our testing capacity to perhaps track down asymptomatic patients who may be silently spreading the virus?
Yes, I believe one of the big successful quarantine strategy in Korea are deeply rooted in this extensive and thorough diagnosis test. The problem is that in order to reserve some of the medical resources, the only people above certain criteria are targeted for the testing. So, of course, there are some professionals saying that the laboratory capacity doesn't matter. I mean, the problem is that we have a very high criteria for the COVID-19 testing. Currently, the condition for the receiving the test is like when you go outside and stay abroad and then come back to the Korea and having some certain kind of symptoms for within 2 weeks, or you have the symptoms and also have the evidence that you are linked with the epidemiological issues in the local areas, or you have to have symptoms and also you have to have the doctor's opinion. So in the cases like these today, most of the increasing number and confirmed cases are from asymptomatic cases, which Dr. Kwok said, the unrooted cases. And they are excluded from this criteria. So I think now is the time that the government and the quarantine authorities should rethink about the systemic improvement of this, the criteria for testing.
I see. Dr. Kwok, in a recent article, the Wall Street Journal claimed Korea had cracked the code to containing COVID-19, and it highlighted, quote, blending of technology and testing in Korea was unparalleled, of course. How would you evaluate Korea's response to the latest outbreak?
I'd say they are doing their best. We are still keeping a very good balance between keeping the economy going and still mitigating the spread of the virus. From the medical perspective, I think they could have done better in the sense that they could have completely locked down the country and have zero numbers further on. But obviously, politicians and people in power who has to really govern the country, they would have to think about the economy, the status of the economy. Also, they would have to think about other aspects of the society. So I would applaud them for the decisions they have made so far, and being able to keep the balance so well between all other aspects of the society and the medical aspect of the society. One other note that I want to make, though, is that this is really of a matter of disease. So it's really, compared to other sources of, let's say, death, it's still quite subpar to the average of other sources of death. We're really dealing with a disease that scares people because it kills people, but there are other sources that kill more people. So what I want to say is that the government is doing a very good job in balancing in all aspects of the society currently.
Right. Professor Chung, as authorities have highlighted time and time again, current containment efforts were possible because of active public support. And speaking of that, let's touch upon some of the precautions that members of the public can undertake during this Chuseok holiday. Now, as we mentioned at the start of the program, testing centers are open during the 5-week Chuseok holiday. When should a person decide to get himself or herself tested?
So actually, well, if you have the symptoms, then you have to be ready for the test. And also, if you have the history of contacting suspicious COVID-19 confirmed cases, or if you have visited certain areas, then it'll be the case. I think, and for additional information, I'd rather give you is that maybe most of people would fly away or leave the town in the Chuseok period, and I think if you have the suspected symptoms, but you don't know where to contact because it's not your own area right now, then please contact local healthcare center, or which we call 보건소, in the visiting province, because they have the primary responsibility to track and get your COVID-19 diagnosis test, and also they will share the information with the KDCA, the central, to track all about the information. So, and you can also contact dial 129 and 119 for the Ministry of Health and Welfare. And also, if you have some psychological symptoms alongside with this COVID-19, you can dial 1339.
Right, that is good to know. Now, Dr. Kwok, as Professor Chung has just mentioned, almost 1 million people are expected to be at the airports this Chuseok holiday, despite calls against travel by government officials. Now, what preventative measures would you recommend for those within crowded areas?
Right. I would have to start by re-emphasizing the 3 W's. Obviously, wear your mask, watch the distance, and wash your hands. But when we're confined in a space, we have to especially be more careful about spitting, talking loud. Because obviously, when we're talking loud, when we're, let's say, singing a song, we tend to spit out much more droplets and exhale much more virus particles than when we are being quiet. So it'll be best not to talk to other random people, especially when at stations like airports and train stations. Also, if you are going to pick up a to-go food at a certain rest stops and whatnot, try not to pick up those that were exposed to the air before, because droplets can also remain on the surface for quite a while. So it'll be best not to consume those that will have been exposed to possible other sources of virus, but also, as I have to reemphasize once again, 3 W's. Wear the mask, wash your hands, and watch the distance.
Right. Dr. Kwok, thank you for that. And Professor Chung, it appears now that quite a number of people are choosing to delay plans to get their flu shots following reports of improper storage of some of these vaccines and the resulting concerns regarding their efficacy. Do you see these delays as perhaps negatively affecting the government's plans to kind of thwart the twindemic we talk about, the seasonal flu and COVID-19?
Well, actually, I have told before about this, the twindemic, like the issues that we are concerning about this influenza and also the epidemic of the COVID-19. And there is some evidence that if we got the influenza first, then there are a relatively lower risk of getting the COVID-19. However, but when you are the target of the co-infection, which means you get 2 things together, then the fatality grows up significantly. So I think, fortunately, this Chuseok season, I think it's a bit early for the epidemic of seasonal flu. So maybe, even though we didn't get the flu shots, but right now it'll be okay for a while. However, we should be really careful about our future and like November, December after that. So if you are if you didn't get the flu shot, I recommend please get the flu shot as soon as possible, maybe at least end of November. And also, if you're older than 65 years old, you also have to check that if you already got the pneumococcal vaccine, another one. And if you think you have the symptoms of influenza, and also if you had the chance of getting COVID-19 confirmed cases, contact or visited certain areas, then please do not go to the crowded area. Just stay and take a rest, and then consider about taking COVID-19 tests with the proper consultations.
Right. Dr. Kwak, a very quick question about what Professor Chung just said. There have actually been 3 cases of patients who contracted both COVID-19 and the seasonal flu, and they believe that this could severely hamper their road to recovery. Do you agree with these concerns?
Well, there have been numerous different studies about this. In the past, there have been studies of co-infection between other sources of virus, not the COVID-19, and that were shown to be not so effective in making more severe of the disease. So we have to seek further of such cases and get better information on this. But it's just better not to get the virus in total. So let's be careful and try not to get the virus in any ways. But also, obviously, we should all get vaccination.
Right, of course, and make sure we don't catch COVID-19. Very briefly, Professor Chung, maybe a few words of advice for those ready to spend Chuseok holiday.
Yes, actually, I think the most proud aspect of Korea's response against COVID-19, I think, is the citizens. I mean, they made the cooperation, participation, and the policy compliance. And I think this government have done really well, and I think citizens have done also a really well products. So I know maybe most of us are now facing their limits. I mean, they are having some problems mentally, physically, or maybe economically. And we struggled and endured very well. However, I think this season is now, we want to just take a break, because we haven't struggled our daily lives. But now this is a chance that we can plan for our next 6 months or so for the sustainable social distancing. So I think we have to prepare for the worst right on, but maybe we can hope for the best. So maybe I think enjoy your holiday, and thank you very much.
Right. All right, Professor Chung, thank you for your words. And Dr. Kwak, as always, thank you for being with us today.
Thank you.
Right, well, that brings us to the end of this week's coverage of COVID-19. Authorities claim fewer social interactions this Chuseok will ensure fewer virus transmissions. Now, with these words in mind, do have yourselves a safe holiday and see you next Monday. Thank you for watching.